Here's a staggering statistic. More than 22 million Americans experience obstructive sleep apnea. Bedtime may mean hooking up to a web of cumbersome tubes to put on a CPAP machine, but a new device now available for the first time in St. Louis is changing that. And we are happy to have Dr. Matthew Marino with us this morning. He is an ENT surgeon at St. Luke's Hospital, and he is here with us today to talk about a breakthrough treatment option for sleep apnea patients, and it has a very fancy name, and I want to get it correct. Inspire Upper Airway Stimulation Therapy.
Correct.
That's a big name. But what are we talking about exactly?
So basically, Inspire is a new innovative therapy for sleep apnea. It's a surgically implanted device, and basically the way that it works is that it monitors your natural breathing pattern while you're asleep. And in a patient with sleep apnea, where they would normally have their airway collapsing and blocking off, this device sends some stimulation to their airway muscles, opens up the airway, lets the air flow through, prevents those blockages from occurring. You don't have to wear any masks or hoses or other attachments. And then there's a remote control like this that you turn it on and off with that you keep at the bedside.
That's pretty amazing, and I'm sure it's changing people's lives, and not only the patients, but maybe their partners' lives as well.
Correct, yeah. So bed partners report about 85% reduction in snoring and overnight, and to softer, no levels of snoring at all. So it definitely helps with relationships as well.
I'm sure. Who is the best type of candidate for this?
So the best type of candidate, we're looking at patients who have moderate to severe obstructive sleep apnea, patients who have tried other therapies like CPAP or oral appliance therapy in the past and have failed those treatments, patients who are not significantly overweight, so we're looking at patients with body mass index or BMIs of about less than 32 ideally, and then patients who are over 22 years of age.
And this is an outpatient.
It's an outpatient surgery, yeah. So it's a couple hours of surgery. There's 3 small incisions that are made for the 3 different components of the device. About a week of light activity after the surgery, and usually mild to moderate pain for a couple of days.
And St. Luke's is the first to be doing this in the St.
Yes,
Louis
it's the
area?
first center to offer it in the state.
That's really amazing.
Yeah.
And I'm sure over the next few years we're going to hear even more about it. Well, as you mentioned, Inspire does definitely help with snoring.
It does.
Good.
Yeah, absolutely.
How many patients do you think will come in even this year to get this?
Oh, I think there'll be a multitude of patients that come in. We are seeing probably 3 to 5 patients a week that have interest in it. And not everybody's a candidate for it, but there's quite an interest in it. And there's just a lot of people out there that can't use their CPAP or have a hard time with it, or just can't tolerate it for a variety of reasons.
And at the end of the day, if you get a poor night's rest and your partner's getting a poor night's rest, the next morning probably isn't going to be the best either.
Yeah, if you're not getting a good night's sleep, you're going to have mood issues, you're going to have memory issues, you're going to be feeling fatigued all the time. So it's not a great way to go through life.
Truly a life changer.
Yeah, absolutely.
Nice to meet you. And
nice
this
to meet
is
you.
just absolutely fascinating stuff. And to learn much more about Inspire, there will be a free community education event tonight at 6 o'clock at St. Luke's Hospital. It is not too late to attend. Visit stlukes-stl to register for the Health Talk. And for more information about Inspire or tonight's event, call the number on your screen. It is 314-274-9429. Guys, the advances in medicine are just amazing.
That is some fascinating technology. That is crazy. Thank you, guys. Very enlightening.